Hello and welcome to a video on IV dosing. In this particular question, we're going to look at a three-factor physician dosing. So right here, the physician has ordered 10 micrograms per kilogram per minute. The IV bag contains 250 milligrams of your medication in 250 mLs of D5W. You do need a patient's weight because it's being dosed by patient's weight, and that's 168 pounds. So the question is asking you, what is the rate on the infusion pump that will deliver the correct dose? So when you're working with infusion pumps, you're looking at a final answer of milliliters per hour. So let's go ahead and plug that in. The next step is to just pick out the pieces of information that we need. So let's begin with the physician's order. The physician has ordered 10 micrograms per kilogram per minute. Pharmacy sent you a bag that contains 250 mLs and that has 250 milligrams of medication. If you remember from basic setup, I'm going to leave the milliliters on the top because that's what I'm looking for, so that's going to stay my numerator. The next thing I'm going to pull out is the patient's weight. Now that I have all the information, my next step is to see what kind of conversions I need, and I'm going to use my flip-flops so I can cancel out the like units. So in looking at these, I know that there's a milligram microgram disconnect. So I'm going to go ahead and put the milligrams on the top because I want them to cancel, and the micrograms on the bottom. And we know that 1 milligram is 1,000 micrograms. The next conversion I'm going to need is 1 kilo is 2.2 pounds. And I'm also going to get rid of my minutes by saying that 60 minutes is nothing but an hour. So it looks like I have everything, but again, we never assume. So let's go ahead and cancel out some of this to see what's left. So I know the minutes cancel out, micrograms cancel out, milligrams have a partner, pound has a partner, and so does kilo. So which basically leaves me with milliliters per hour. And that's exactly what I wanted in the first place. So now I'm ready to hit the calculator. And when I do, if I multiply all my numerators, I should end up with 25, 200, and 1, 2, 3 zeros divided by 55, 0, 1, 2, 3 zeros. Now watch these zeros on your calculator. I've seen a lot of students trip on them, so make sure you count them out. So when you go ahead and calculate this, you should end up with 45.81. Now that's a decimal, so let's talk about rounding. Each test question has a different rounding instruction, so be sure to follow the instructions on your exam. So let's practice 2 right now. If your test question said to round to the 10th, then your answer is going to be 45.8 milliliters per hour. If the test question said to round to a whole number, then you're just going to leave it at 46 milliliters per hour. So here are your 2 options. Be sure to read your instructions. Again, to do a quick recap, plug in the final unit you're looking for, pull out the physician order, pull out the pharmacy bag, pull out the patient's weight. The rest of this is just conversions. How many do I need? What do I need? And how do I get there? Oops, sorry, that includes this one as well. So again, this is IV 3-factor dosing. Hope this video was helpful. Thanks for watching.